Hello everyone. This demo is presented in student design competition MobileHCI 2022, which talks about steer clear of anxiety towards detecting anxiety in novice drivers through smart glasses. This work has been equally contributed by Debashri Das, Pragya Kara and Sugandh Pargal from Indian Institute of Technology, Kharagpur and Jadavpur University, India. As we know that there are various accidents occurring on road for every now and then, one of the most influential factors leading to such accidents is the driving anxiety. This anxiety is usually arising in case of drivers due to their lack of experience, confidence, or concentration while driving, specifically in case of the novice drivers who are new to the driving experience. And if such drivers are given the license, it might lead to increase of fatal accidents. For this purpose, there is a need to detect the anxiety among the drivers at a very early stage, such as driving license generation. Currently, the license is generated based on the written examinations related to some of the driving rules and the practical driving test. However, we aim to develop a system that also tests the driver based on his or her anxiety level. If they are still anxious while driving, they should be provided with more training where they will be auto-corrected when they feel anxious. Next, we discuss the overview of the system here. Here, to avoid any kind of distractions, we ask drivers to wear the smart glasses, which captures the head movement, head gestures, and touch activity of the hands of the driver towards the glasses. For this purpose, the glasses has the embedded IMU sensors, which captures the acceleration and orientation of the driver's head. Also, it consists of capacitive sensors, which captures the touch pattern of the driver to the glasses, such as tapping, pinching, sliding, and knocking. With the help of this data, we estimate whether the driver is anxious or not. For the purpose of ground truth, we utilize Empatica E4 Smart Band, which is worn in the hands of the driver, and it captures the physiological sensor data of the driver, such as the heart rate, EDA value, BPM, and thus gives the anxiety label. With the help of both these devices, we tried to capture the anxiety label and provide a recommendation whether that driver is anxious or not. Next, we demonstrate how our system works based on few video instances of the front road and the in-car view where the driver is driving along with the instructor. And the instructor is using the phone where the information is getting logged from the smart glasses and the Empatica smart band, and he is getting a label whether that driver is anxious or not. In this video, we show the instance where the pedestrians are approaching towards the car and the driver is a bit anxious. So the instructor instructs the driver to follow the road accordingly and move the steering wheel apart from the pedestrian. In the next set of video, you can see an instance when the driver is about to take a turn and the instructor is handling his steering because of the notification of the driver being anxious. So the driver is being anxious because of his continuous head movement and his hand movement towards the smart glasses. In the next illustration, we see a video where there is a car approaching in case of a turn ahead, and the driver is not able to control the car, his car properly. So the instructor is instructing the driver as he feels that the driver is a bit anxious. In the last instance, we show a plain road where there is no obstacle or not any kind of difficult maneuver. So the driver is driving the car in a very proper manner and with the normal speed. So the instructor sees the not anxious label and also appreciates the driver for such behavior. Finally, we conclude that such kind of systems would be very helpful for the license generating agencies to check whether that driver is still anxious while driving or not, or whether he is very comfortable while driving or not. Such systems will also help the cab companies and the driver themselves to automatically correct whenever the driver is leading to the anxious state. Thank you.